Next paper is presented by Dr. K.P. Nanayakkara. The paper is a case series on acquired platelet dysfunction with eosinophilia and toxocariasis. Over to you, Dr. Nanayakkara.
A very good morning to all of you. Firstly, I must express my gratitude to Sri Lankan College of Dermatologists for giving me this opportunity to use this platform, and to my mentor, Professor Jayamini Senivarath sir, for the persistent support. In next few minutes, I would like to discuss about 6 patients with acquired platelet dysfunction and eosinophilia, which we have been diagnosed and managed at Lady Ridgeway Hospital during the calendar year of 2019, and there was a possible association with toxocariasis. Acquired platelet dysfunction with eosinophilia is an uncommon disease, but it's nothing new. It was first recognized by Sue in 1974, far back in 1974. That time the name non-thrombocytopenic purpura with eosinophilia was given, and by 1979 the name acquired platelet dysfunction with eosinophilia was coined. Rather than rare, it is actually an underdiagnosed entity in South Asian countries, possibly due to the darker skin complexion, which make it difficult to diagnose the faint purpuric lesion, and also usually the self-limiting nature of the disease. Now, in our case series, we have, and there is also a possible seasonal incident of the disease which suggests infective etiology. In our case series, this is one of our patients with a lesion in the lower limb. We have noticed 6 cases within 2019, mostly in the middle third of the year, and out of that, out of 6 patients, 2/3, that is 4, were males, and the age ranged from 2.5 years to 7 years, with a mean age of 5.7. And all these patients presented with transient purpuric lesions, faint purpuric lesions, majority single and majority over the lower limbs. Exceptions were 2 patients, one over the face and another one over the chest. Other than the cutaneous manifestations, we hardly recognize any mucosal or other extracutaneous bleeding manifestations or other associated systemic manifestations. Now, another significant finding we recorded was the positive association with dogs in almost 5 out of 6 patients. This patient had a lesion, a transient lesion over the cheek. Now, this chart shows the distribution of the 6 patients. You can see that except patient number 5, all other had a positive contact with dogs. This one had a lesion over the thigh. Now, laboratory evaluation showed a mild to moderate leukocytosis with varying degree of eosinophilia, of which highest was 40%. And it was present in all 6 patients. Platelet count and the coagulation profile was unremarkable, except prolonged bleeding time in 2 of them. Now, the most significant association we found was in 5 out of 6 patients, we found positive serology for toxocariasis. And they all were treated with albendazole, and except one, there was excellent response to albendazole. Even the patient with recurrent and multiple lesions responded to several courses of albendazole. This is a sketch of investigations. You can see that 5 out of 6 patients are positive for toxocariasis, which was the significant observation, which has not mentioned previously in the literature. This patient had a lesion over the chest. Now, acquired platelet dysfunction with eosinophilia is an uncommon disease, as I mentioned, predominantly seen in the Southeast Asian countries like Thailand, and increasingly diagnosed entity in Sri Lanka. And in our setting, the increased prevalence of positive serology and response to albendazole suggests association with toxocariasis. Also, the canine contact. This patient had stubborn lesions, multiple recurrent lesions over the lower limbs. In all these patients, other possible associations of bleeding diathesis has been excluded, mostly in the medical units. Toxocariasis is a zoonosis caused by human nematodes, non-human nematodes, Toxocara canis and cati, and cutaneous manifestations are quite diverse. And most commonly being chronic urticaria, but even prurigo, dermatitis, dyshidrosis, eosinophilic folliculitis, and vasculitis has been noted, even superficial migratory panniculitis. But the literature survey has not shown a significant association previously with toxocariasis, and this is the first time it has been reported. And this warrant further evaluation of a large sample for toxocariasis. Thank you. Actually, the best test for the functional platelet abnormalities ristosacin aggregation test, which was at that time not available in the MRI, but now the test is available. Yes, madam. The problem with our setup is the poor referral system. We get patients rarely through medical units because they extensively evaluate for other bleeding disorders, and by that time the disorder is self-healed. So our pool is very low, but I think we need a larger sample to credibly establish credible association between Toxocara and acquired platelet dysfunction, and we can now send samples to MRI for ristosacin aggregation test. Yes. Yes. In one patient with the superficial migratory panniculitis, we have done a biopsy where we saw the larvae particles on direct microscopy. Thank you.
Absence of any other questions, I would like to present the certificate to the presenter.
Nanayakkara, you had to